As a natural holistic doctor for over 20 years now, my mission has always been to educate and empower individuals with knowledge and really the tools to help you achieve optimal health naturally. So understanding various health conditions and their underlying root cause is really a critical part of this journey. So today, over the next 10 to 15 minutes, I want to talk to you about hyperthyroidism and Graves' disease, two very interconnected thyroid disorders that affect really millions worldwide. So by diving into their causes, their symptoms, their treatments, we can really better understand how to manage and mitigate these conditions using holistic approaches. So let's start by talking about what is hyperthyroidism. So a lot of people will talk to you about hypothyroidism. That is more common, but what I want to dive into today is hyperthyroidism. It's a condition where the thyroid gland, which is this little teeny gland located at the base of your neck, and it might be small, but it is mighty, and it's when an excessive amount of thyroid hormones are released from the gland. These thyroid hormones, T4, T3, they regulate the body's metabolism, influencing really how fast or slow the body functions. And when these hormones are overproduced, it really accelerates the body's metabolism and can lead to various health issues. And there are a few causes of this. That would be the next question. Why would this happen? Well, most common reason for hyperthyroidism is Graves'. And Graves' disease is an autoimmune disease where the immune system mistakenly attacks the thyroid gland, causing it to produce too many hormones. Now, there are a variety of autoimmune disorders that can really over 100 that can be diagnosed in the body, and there are two that are related specifically to the thyroid. So one would be Graves', which leads to the hyperthyroidism, and one would be Hashimoto's that leads to the hypothyroidism. A second thing that can cause quite a few problems with hyperthyroidism would be thyroid nodules. These overactive nodules are like lumps in the thyroid gland. They can produce excessive thyroid hormones independently of the gland's like normal regulation. So really important if you do feel any nodules in your neck to get that checked out right away. Sometimes you can even have thyroid nodules that you don't actually actively feel it. Or if you're not used to feeling for those types of things, you could miss it. Thyroiditis is another cause of hyperthyroidism. Thyroiditis, itis meaning inflammation. It's inflammation of the thyroid gland. And it's often due to a viral infection or autoimmune condition. And it can cause the stored thyroid hormone to leak into the bloodstream. The other one is excessive iodine. Now, I know a lot of people are going to Google and they're Googling what should I do for my thyroid. And you can take things that you don't need. And excessive iodine in high intakes from either the diet or medications, that can stimulate the thyroid gland to actually produce excess hormones. So really critical if you do have hyperthyroidism or any concerns about your thyroid, that you're actually understanding the root cause so that it can get corrected appropriately. I kind of alluded to what happens with hyperthyroidism. There are quite a few symptoms. You can think of it simplistically like everything speeds up. You can have a rapid, and you don't have to have any of these symptoms or all of them. So that's why symptoms, they're really clues. That's what I say all the time. Symptoms are clues. They're your body's way of talking to you. Doesn't really tell you exactly what's wrong or necessarily always that something is wrong. It just tells you that you need to be looking a little bit deeper. So symptoms can be varied and wide. Rapid and irregular heart or pretty common ones. Unintentional weight loss, like you don't know why it happened. Nervousness, anxiety, tremors in the hands or in the fingers. You could have also just an increased sensitivity to heat. You could also start sweating more or have fatigue or muscle weakness, difficulty sleeping, frequent bowel movements. Again, the symptoms really are varied and wide, so make sure you're really seeking out where that's coming from. Now, Graves' disease, as I said, it is a specific cause of hyperthyroidism. It is an autoimmune disorder, and what it involves, I guess I should say, is the production of antibodies, these thyroid stimulating immunoglobulins that stimulate the thyroid to produce too much thyroid hormone. And this condition doesn't just discriminate against the thyroid, it can also lead to problems in other areas or other systemic issues. It can cause problems with the eyes, bulging of the eyes where the eyes look like they're bigger or kind of bulging out, and less commonly, it can cause problems, dermopathy, skin issues with Graves as well. So it's not necessarily specific just to the thyroid. Now, Graves' disease, I guess the question would be, where does that come from? Why does somebody get Graves' disease? Now, in standard research, they're saying the exact cause is unknown, but we do now know that several factors may contribute to its development, one of which being genetics. Now, I always say genetics are like books on a bookshelf. It doesn't necessarily mean that you're going to take that book down, or that because your mom had it or your dad had it, you're doomed for it. But a family history of autoimmunity, certainly, really any autoimmune condition can increase the risk of, so that you've got more books on your bookshelf, and then it's lifestyle, that can help you manage keeping them there. The other problem is with gender, really. Women are 5 times more likely to develop Graves' disease or autoimmune conditions than men. Stress is a really huge triggering factor. So physical, emotional stress can trigger at the onset of Graves or any autoimmune disorder, as well as infections. So certain infections might play a role in initiating that autoimmune disorder. And for symptoms of Graves itself, you can think in addition to hyperthyroid symptoms, because remember, like, these are 2 different things. Hyperthyroidism and Graves causes this. So a lot of times people are thinking they're one and the same, or they'll say my hypothyroidism is Hashimoto's. Well, it's caused by. So just understand the difference between them. But there are some unique symptoms with Graves in and of itself. Again, the eyes bulging is pretty common, but not just bulging. It could be redness or swelling. We can see discomfort in the eyes. In severe cases, it can affect vision problems. Most of the time in the beginning, it's not affecting the vision yet, just what it looks like. The Graves skin issues, dermopathy, thick red skin, it's usually actually kind of on the shins or even the top of the feet is where we most commonly see it. Another symptom of Graves would be a goiter, like your thyroid gland getting enlarged, and it can oftentimes, you can see it as like a noticeable bump out. And when you see these types of things, it's important to look, what are the different treatment options? Conventional treatment options for hyperthyroidism and Graves are medications. So an anti-thyroid drug, medications that reduce the production of thyroid hormone are very common. There are beta blockers as well. These drugs don't affect thyroid hormone levels, but they can help to manage those symptoms, such as the rapid heart rate, the increased levels of anxiety. Another common conventional treatment is radioactive iodine therapy. This treatment involves taking radioactive iodine orally, which destroys those overactive thyroid cells, reducing the hormone production. And in severe cases, unfortunately, surgery where they remove part or most of the time all of the gland removed surgically. And then what happens with surgical removal, then you'll be on medications for hypothyroid, because then there's no thyroid to produce any thyroid hormones. So what we want to go towards, what in these measures conventionally are necessary at times, if you are taking a medication for hyperthyroidism, I'm not saying to get off your medication, please don't do that. I am saying that you've got to understand, even if you're taking a medication for anything, what is the root cause? Where is it coming from? Because if we don't address that root cause, is it going to stay the same? Is it going to get better? Is it going to get worse? Probably not going to stay the same or get better. It's probably going to get worse. So holistic approaches to managing that hyperthyroidism and Graves can complement the conventional treatments, again, addressing the root cause and improving your overall well-being. Because what I see a lot of times is that patients are coming to me, they're on medications and they're still feeling like crap. So that's not going to work. So we've got to dive a little bit deeper and look into things like diet, nutrition, stress management. One of the fastest, easiest places to start would be an anti-inflammatory diet. Reducing inflammation can help to manage autoimmune responses. So please think about focusing on whole foods. Remember that your food is fuel for your body. Staying away from those boxed processed items, especially if you can't even read the words that are on the label. And then I do want you with hyperthyroid to avoid iodine-rich foods. So iodine is essential, but it's the too much iodine that can exacerbate hyperthyroidism. So please be mindful of iodine intake, and again, even certain medications. Herbal remedies can be really beneficial. So there's one called buggleweed. This herb is traditionally used to manage mild hyperthyroidism by inhibiting thyroid hormone production. Lemon balm is another really cool herbal remedy. It has a calming effect, and it can help to reduce anxiety and manage that picking up, with hyperthyroidism, it's like everything picks up. So it would make sense that anxiety would be a part of that. In addition to herbal remedies, mind-body practices can can be game changers, and there are dozens and dozens of them that are out there. One of my favorites is meditation. One of my least favorites is yoga, but a lot of people love yoga. For me, I think, well, I don't have to love yoga. I'll choose a different mind-body practice, meditation, journaling, getting out in nature, walking. So find practices that really help you manage stress, because as I said, stress is a known trigger for autoimmune responses and thyroid dysfunction. Another fun thing that you can try, which I think is really cool and helps with a variety of issues, especially thyroid issues, is acupuncture. Traditional Chinese techniques have been around for hundreds of years and have been used to help balance the body's energy and improve thyroid function. A couple of supplements you could look into: L-carnitine. So the studies have shown now that it could help to reduce hyperthyroid symptoms by inhibiting the entry of thyroid hormones into your cells. Selenium is another essential mineral. It supports thyroid function. It can reduce inflammation in autoimmune thyroid conditions. And if you do any supplementation, please, I would encourage you to look at that under the guidance of somebody that can tell you how to dose it correctly for you, versus, again, just going maybe to the grocery store and picking up one of these things. But these are the questions you want to ask. What about L-carnitine? What about selenium? What about these different herbal remedies? And then layering in these stress management techniques, like I said, deep breathing exercises, meditation, mindfulness, regular physical activity is critical for managing stress levels. I know you guys know this, but sleep hygiene, I feel like I've beaten people on a stick with talking about sleep and sleep hygiene. It may sound funny, but your morning routine sets you up for a great day, and your bedtime routine sets you up for a great night. So we really want to ensure that we're gifting the body the time that it needs to rest, to heal and repair, because when you sleep is when your body fixes itself. So quality sleep is crucial for overall health, not just hyperthyroidism, but can really help to manage these symptoms. So understanding hyperthyroidism for you or for your loved one, understanding Graves' disease, it's a first step in helping to manage these conditions effectively. And while conventional treatments are essential, incorporating holistic approaches can provide that comprehensive path towards better health. With all of these things, we can support the body's natural healing process. We can achieve a balanced and a healthy life. And if you or a loved one is struggling with hyperthyroidism, Graves' disease, please consider talking to a holistic practitioner. They will help you explore personalized, natural treatments. I just had somebody say today, it's too overwhelming on the internet. So I would encourage you to find a partner, because what I find, a lot of people are just burning time and burning money and losing quality of life just trying to figure out what to do. So together with a qualified functional medicine practitioner, a holistic practitioner, you can work as a team towards a healthier, more balanced life. So please feel free to reach out to me for more information. You're always welcome to schedule a free consultation. And please comment below if you have any questions. Please like this. What that does is it tells YouTube that you want to see more things like this. And then as we put out new videos, you'll get alerts that those videos have come through. So your healthcare journey can be a collaborative process, and I am here to support you every step of the way. Have a wonderful rest of the day, and we'll see you soon.